So let's talk about ketamine therapy. You've probably heard the name floating around, and for good reason. It's causing a major shift in how we think about mental health. In this explainer, we're going to cut right through the noise and get to the clinical facts. What is it? How does it actually work? And who is it really for? Especially for those of you who feel like you've already tried everything else. Let's dive in. You know that feeling of being stuck? It is an incredibly frustrating place to be. You've tried different treatments for depression or anxiety, you've done the work, but you just feel like you've hit a wall. For so many people, this isn't just a minor setback, it really feels like the end of the road. But what if there was a genuinely different approach? Well, that's exactly where ketamine therapy comes into the picture. We're talking about a specialized clinical intervention that can offer significant and often really fast relief for people with what we call treatment-resistant conditions. This isn't just another pill, it's a completely different way of tackling the problem at its source. So what's actually happening inside the brain here? This isn't about just masking symptoms for a little while. Ketamine therapy works by actually encouraging fundamental changes in your brain's chemistry and its physical structure. Let's get into the science of it. Okay, the magic word here is synaptogenesis. I know, it's a bit of a mouthful, but the concept is actually pretty simple. It just means the growth of new connections between your brain cells, your neurons. Ketamine actively encourages this process, which in essence helps your brain build new, healthier pathways. This boosts its natural ability to adapt and change, a quality we call neuroplasticity. I absolutely love this metaphor. Repairing the wiring. It's just such a perfect way to visualize it. Think about it. Chronic stress and depression can literally wear down and damage these crucial neural circuits over time. Ketamine comes in and helps the brain physically rebuild and strengthen those very connections. It's like an electrician for your brain. This chart really lays it all out, doesn't it? On one side, you have traditional SSRIs, which can take weeks, sometimes months, to work by adjusting serotonin. But ketamine, it works fast and it works differently by getting to work building those new connections we just talked about. This often creates what patients describe as a window of clarity, a real breakthrough moment that is the total opposite of that emotional flatness some people feel on other medications. Okay, so you might be wondering, what does this journey actually look like for a patient? It's so important to understand that this is a highly structured, medically supervised, and very personalized process. So let's walk through the clinical pathway, step by step. First things first, this treatment isn't a fit for everyone, and the screening process is rigorous for a very good reason. To even be considered a candidate, you typically need a referral from your psychiatrist, a documented history showing that at least 2 other antidepressants haven't worked for you, and a stable support system. This thorough screening is the absolute first and most important step to make sure this is a safe and appropriate path for you. As you can see, the path is really comprehensive. It all kicks off with a deep dive consultation and a physical assessment to get all your baselines. Then you move into the core of the treatment, the induction phase, which is usually 6 sessions over about 3 weeks. But listen, the treatment doesn't stop there. Every single session is medically monitored from start to finish, and it's followed by what might be the most important part, integration therapy, to help you make sense of it all. From there, a long-term maintenance plan is built specifically for you. With any powerful medical treatment like this, patient safety is the absolute #1 non-negotiable priority. So this next part is all about the rigorous protocols that are in place to protect you every single step of the way. And that brings up a really crucial question, right? Why is it so essential for this to be done in person in a clinical setting? I mean, you might see other options out there for at-home treatments, but the clinical standard exists for one overriding reason: your safety. See, during a session, ketamine can cause some temporary changes in your vital signs, like blood pressure or heart rate. Now, these changes are usually pretty minor and they don't last long, but having trained medical staff right there with you ensures that any little fluctuation is managed immediately. It's all about proactive, constant monitoring and being ready for any scenario. This table is so important because it shows that not all ketamine therapy is created equal. The standard clinical approach, the one on the left, is comprehensive. It involves deep diagnostics, it treats you as a whole person, not just a symptom, and it follows strict medical guidelines. And maybe most importantly, it tracks your progress with real objective data, not just how do you feel today. This is the huge difference between a true medical procedure and a more general wellness experience. So let's quickly run through a few key safety terms you should know. Vigilance just means that constant, hands-on observation during the session. Rescue protocols are the pre-planned responses the medical team has ready for any situation. Informed consent, that's not just signing a form, it's a deep, ongoing conversation about all the risks and benefits. And post-session monitoring makes sure you're cared for and stable for at least 90 minutes after the session is over. So, what happens after that initial series of treatments? Is that it? Not at all. This isn't just about a short-term fix. Let's look at how this becomes part of a long-term plan for wellness. Okay, this is such a key point to understand. This is not a daily, lifelong medication. It's better to think of it as an intervention, a powerful tool that we use strategically to break that vicious cycle of severe symptoms. The whole goal is to open up that window of clarity we talked about, creating a period where your brain is more flexible, more plastic, so you can then work with a therapist to make real, lasting changes. So how do we actually know if it's working? Well, it's not just a guess or a vague feeling. Reputable clinics use standardized, data-driven scales. You might see acronyms like PHQ-9 for depression or GAD-7 for anxiety. These tools give us concrete numbers to objectively track how your symptoms are improving over time. It shows us exactly how effective the treatment is for you personally. And this really brings everything full circle. Ketamine isn't meant to be a replacement for therapy. It's a powerful catalyst for therapy. The treatment creates that rewired brain state, that newfound neuroplasticity. Then integration therapy is where you really do the work, using that new mental flexibility to make deep, lasting changes to your thoughts and behaviors. It's like one unlocks the door and the other helps you walk through it. And so we end on this thought. For anyone out there who has felt that they have truly run out of options, ketamine therapy represents a real, significant, and science-backed shift in mental health care. By offering a completely new path, one that's grounded in brain science and wrapped in rigorous clinical safety, it offers genuine new hope. And the question it leaves us with is a powerful one. Could this be the key to finding the clarity and stability you've been searching for?